Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Interagency Task Force warns travelers giving false information amid the threat of the Omicron COVID-19 variant. France now will be part of the country's red list beginning December 10. And later, hospitals now seeing a decline in COVID-19 cases. How are they preparing for a possible surge? PGH spokesperson Dr. Jonas Del Rosario and East Avenue Medical Center Chief Officer Dr. Alfonso Nunez joins us live. One of 8 Filipinos who recently flew into the country from South Africa has been located. Authorities say this overseas Filipino worker is under home quarantine, had a negative RT-PCR test, and does not exhibit COVID-19 symptoms. While the whereabouts of the 7 others remain unknown, the government now warns of possible consequences against travelers who will provide false personal information. More from Trisha Tirada.
The IATF is appealing for everyone's cooperation in locating the 7 missing travelers from South Africa. IATF co-chairperson Carlo Nograles warned of sanctions for violators of health protocols.
Ayoko rin silang takutin, no? Whoever you are, please come, no? Immediately and report yourselves, submit yourselves, no, for testing immediately and report yourselves immediately to authorities. No, we're not scaring you. We want your cooperation. Last resort na yung sinasabi na magsampa pa ng kaso.
The health department said 2 of the missing travelers gave either incorrect or incomplete numbers. 3 provided the numbers of the agencies, while the remaining 2 are unreachable. The agency also said it is coordinating with local officials to reach the missing people. Meanwhile, the Bureau of Quarantine assures the public it is ready to enforce the strictest protocols to prevent the entry of the Omicron variant. The government is on alert as more countries report cases of the new variant, but the IATF says some criteria will still have to be met before putting a country under the red list.
Binabantayan rin namin yung capability also of the country to do biosurveillance, genomic sequencing, kasi baka maaring tumataas ang bilang ng isang country in terms of the COVID cases, but even if they don't report Omicron, it may just be the delay in the biosurveillance being done in that country na hindi naman nila agad-agad na detect yung Omicron.
Ito naman pong measures na to hindi na po bago sa Bureau of Quarantine at sa lahat po ng agency na nag-aalaga sa mga papalik nating mga kababayan. Dahil ito rin po yung measures na ginawa natin nung panahon po ng Delta. So, masisigurado po namin na may implement natin yung pinakamahigpit po na protocol based po doon sa mga binababa ng guidelines ng IATF.
Nograles also said the IATF is stepping up its 4-door strategy, which include testing and strict protocols against travelers, including overseas Filipino workers. Trisha Tirada, CNN Philippines.
The Interagency Task Force has just included France in its red list countries or areas deemed high risk for COVID-19. This brings the total number of red-listed countries to 15, including South Africa, where the Omicron variant was first detected. Meantime, the health department logs less than 1,000 new infections for the 15th straight day. Octa Research has also classified Metro Manila as very low risk for COVID-19. Let's go straight to the source of the story. First off, we have Philippine General Hospital spokesperson Dr. Jonas Del Rosario. Dr. Jonas, welcome back to The Source and thank you so much for your time.
Magandang umaga, Pinky, and to your televiewers. Thank you for having me.
It's good to have you, sir, and it's also good to find out a number of, better news lately or good news lately. PGH, ang sabi daw, has not admitted any COVID patients in the last couple of days. So how long has it been?
Well, that was a few days ago, Pinky. But now we were seeing a trickle of patients, but more or less about an average of about 2 to 3 patients a day. For the past week, there was a time na naka zero, but now small numbers. But that's nothing compared to what we were seeing during the surge, wherein we average about 20 patients a day when we were at the height of the surge. So, and then our numbers, even though we're admitting patients now, mga 2 to 4, we're also discharging patients, and some of the patients have recovered and are being sent home. So more or less, our numbers have stabilized in the 50s na kami, no? Number of COVID patients in the hospital. That's in fact, that's the lowest we've been for the last, I would say, 18 months. So sana tuloy-tuloy na po na bumaba ng bumaba.
I join you there, sir. Sana ho, tuloy-tuloy ang pagbaba. So you average about 2 to 4 patients a day. And there are a number of them who also are being discharged. But can you tell us the symptoms or the severity, at least, of the 2 to 4 patients that arrive or that are being admitted, rather, on a daily basis now? Matitindi ho ba yung kanilang mga symptoms?
Some have moderate, some have severe. No, some will have to be in the ICU or will need some type of higher support of oxygen, like a ventilator or high flow oxygen. We're not seeing the milds anymore. No, they're usually probably just being managed at home. So I was looking at our census today. Our Pay COVID hospital has only 5 patients. And the rest are, and then our ICU, about 9 patients. So out of the 20 beds we have allocated for COVID. So our utilization rate is down to, if we have about 350 beds for COVID and we have about only 56, that's not even 20%. So probably more toward 15% of our bed occupancy. So there are still some patients who need ICU care.
Opo. And you were saying that most of them are on the moderate or severe cases. Just looking into the profile of these patients, have they been vaccinated? Ito pong sinasabi yung severe, moderate to severe cases.
Most of our patients who are in the ICU are unvaccinated. Although having said that, there are some vaccinated patients also, and they have comorbidities. But just like what has been seen, especially during the surge, we a lot of the patients who are critical are unvaccinated.
All right. So what about, I want to go into the healthcare workers. Dr. Jonas, how are they doing? Do you have any positive cases coming from our frontliners?
Again, I reviewed for the last week. We probably had 1 healthcare worker who was positive, but that's not even a healthcare worker. No? I think a medical student. So far po, 0 for the past 2 to 3 weeks. We have not had a breakthrough infection in our healthcare workers. Most of our healthcare workers have been fully immunized. So and we have a low threshold in testing our healthcare workers if they would like to be tested because they feel something different or they have symptoms that might be COVID or they have exposure to someone, we test them right away. And we're very happy whenever we look at the numbers. Now, let's say out of the 20 healthcare workers tested in a day, 0 ang may COVID. So that's a good sign.
Yeah. So most of the healthcare workers also, have they gotten their booster shots?
We are the booster giving boosters right now is ongoing. The last time I checked, there are about 1,000 healthcare workers who had their boosters already. We have some of our healthcare workers got their boosters someplace else. So, but we're still doing the booster immunization right now. So we're hoping that almost everyone who's eligible, which is usually we set it at 6 months from the second dose of whatever vaccine they got, that's the time that we will give them the booster.
Mga ilan pa pong healthcare workers there in PGH are in need of booster shots or should be getting their booster shots soon?
I was looking at the list. If you look at all the people who got vaccinated in PGH and got their primary series in PGH, there were about 4,000 to 5,000 people who got vaccinated. And so if we have 1,000 who already got it, roughly there are probably at least 2,000 to 3,000 more. But some of them actually wouldn't want to get the booster anymore because they got it from someplace else, or some had infection. Siguro at least maybe, Pinky, safe to say we probably need to vaccinate about 1,000 at least pang healthcare workers who are eligible for the booster this December.
So the next question now would be, with what we've discussed, 2 to 4 patients a day coming in, and your healthcare workers, none of them testing positive in the past couple of weeks or the past 2 weeks. I wonder, kamusta po ang emergency room ngayon sa PGH? And also, I would like to ask you to give an advice to those who may have postponed, rescheduled, or did not want to do certain checkups or procedures. Is this the right time to do it? But we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, PGH spokesperson, Dr. Jonas Del Rosario. Dr. Jonas, before we go to the situation at the ER, I wanted to find out, are there children now being admitted for COVID?
The PEDA COVID now has only 5 patients with COVID. So paminsan-minsan may na-admit. It's still not 0, but only 5. There was a time we had about 20 COVID patients, pediatric COVID patients. So it's also, the numbers are also going down.
Okay, yeah, we talked about that, and that became a cause for concern when there was this idea that, and this fact actually, that there were a number of children being admitted for COVID. So how is the ER now? Am I supposed to assume na maluwag ang ER ngayon?
Well, ang nangyari, Pinky, yes, we have, actually we have a new emergency room. No, the Philippine General has opened a new emergency room, and it's a big emergency room. And ang nangyari po ay dinagsa ang emergency room, and there was a deluge of patients coming in, mostly non-COVID patients, to a point that the ER easily got filled up, and we have a significant number of backlogs. And it's because that the wards could not catch up with the patients coming into the ER, because there's a process of getting them admitted. You have to make sure there's a bed, and then you have to tailor fit it to the type of patient there is. So sometimes some will need a ventilator, so some are critical, so they have to be in a critical bed. So some of the non-COVID patients who came in probably could have been seen in the outpatient department, but people went in, so they had to be at least attended to and assessed, triage. So right now, puno po ang PGH ng non-COVID patients. No? Yung pahinga na naiisip natin na dahil bumaba yung COVID, ay hindi talaga namin na-reach, dahil ito naman ang aming pinagkakaabalahan, mas marami pong non-COVID patients.
I was actually hoping this was a time for our nurses, doctors, our healthcare workers to be able to somehow have more humane hours, at the hospital. But is there specific, meron ho bang sakit na predominant ngayon kaya't napupuno po ang ER?
Well, the usual patients natin, mga ubot-sipon, pneumonia, and then the common illnesses that we attend to pre-pandemic, those with heart problems, lung problems, cancer. Some have surgical problems. Meron pong mga iba na they have had that tumor for the longest time na hindi sila nakapunta sa ospital, and now they really have to be seen and be attended to.
Would you say though that possibly sinasamantala po ang pagkakataon ngayon dahil people are more comfortable because of the low number of COVID cases?
Yeah, exactly. I think there was a time when we were actually trying to recall some of our non-COVID patients whom we know needed an intervention, no? And they would tell us na, Doc, hintayin na lang po namin na hindi na COVID referral center ang PGH, baka mahawa po kami dyan. So ngayon, now that the numbers are going down and it seems like it's quite common in all the hospitals, we're seeing more and more patients now. Parang matapang na po sila magpatingin.
But, I question what you were saying a while ago. Sabi niyo puno ang ER. Sabi ko, ano po ang mga sakit na dahil pumupunta sila sa ER? Sabi mo, sipon, ubo. I mean, ganun ho ba? Pati sipon, ubo, ina-accept na sa ER?
Kasi po minsan, pag nagkakataon na sarado mga clinic or it's a weekend, they look at the emergency room like an urgent type of healthcare facility. And so that's why we advise the public that maybe they can wait. Mahirap din kasi siyempre sa isang tao, sa isang pasyente, pakiramdam niya talaga maluba ang sakit niya, and that's where proper triaging occurs, no? Yeah, assess mo, no? But and then from there, you have to either tell them, okay, this is something that can be treated at home. This is something that cannot be admitted in PGH because we only attend to right now to the more complex one or those who are real emergencies, no? So sometimes we have to transfer them to a hospital of choice or coordinate them to another hospital. It's not easy, Pinky, transferring patients once they're in the hospital already because some of the other hospitals are also full, no?
Yeah.
Andyan na sa PGH, parang some of the patients want to stay in PGH, willing daw silang kahit nakastay na lang sa ER, willing sila na dyan na. Kasi iba po, mga pasyente na talaga na-attend at nakasanayan na nila magpunta sa PGH. We are really hoping that the regional hospitals or hospitals in the LGUs can help PGH so that PGH can probably take care of the more complicated cases, no? And the general cases can be taken care of in smaller hospitals po.
All right. So now that you've said that, the ER is full for the public, sir, kayo na po magbigay ng advice doon sa mga may planong pumunta dyan sa PGH. Sino lang ho ba ang inyong ina-encourage na talagang pumunta sa ngayon?
Okay, thank you for... Ang aming pong payo, una po ay gamitin na natin yung ating OPD. Bukas na po yung outpatient ng PGH. Kailangan nyo pong magpa-schedule. There's a number, a hotline 155-200. That's a hotline and you can set up an appointment and also try to connect with your doctors. You know, a lot of our patients actually are patients of the different services and they actually have, they should establish or reestablish communication with them, mga pasyente po yan. So, i-assign po kayo ng clinic days. So, that's one. So, at least you'll be assessed. And then if there's really a need for you to come in to be admitted, then we will do that. Instead of walking into the emergency room, the emergency room po ngayon ng PGH, because of what happened, puno at marami pong backlogs, we really went back to the appeal that we will be entertaining life and limb-threatening emergencies. For example, po, trauma, heart attack, stroke, those with real emergencies na surgery, mga ganyan po. So yun muna po. And the rest po, maybe you can go to your local hospitals muna po. At kung hindi nila kaya, then i-refer po sa PGH.
PGH spokesperson, Dr. Jonas Del Rosario, thank you so much for your time.
Maraming salamat. Advance Merry Christmas to your team, Pinky.
Advance Merry Christmas to everyone there at PGH. Thank you, sir. And we will be taking a short break. We'll check on the situation at East Avenue Medical Center when we return. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, East Avenue Medical Center Chief Dr. Alfonso Nunez. Dr. Cito, welcome to The Source. And let me already ask you, tell us the situation now at East Avenue Medical Center in terms of your COVID patients.
Yes, good morning, Pinky, and good morning to your viewers. As far as COVID patients are concerned, East Avenue currently has a census of 12 COVID confirmed cases admitted in our hospital. And for the past 7 to 10 days, we only admitted 3 cases of COVID-19 cases. So this is a far decrease in the number of cases from what we came from last August and September. This is actually good news for East Avenue Medical Center and the East Avenue healthcare workers kasi mas magaang na ang kanilang
Po.
pakiramdam. Yung anxiety level is also going down amongst our healthcare workers.
That really makes us smile, Dr. Cito, because after that, after hearing the very low number of cases, is really where I wanted to go. The people at the ER, those taking care of COVID patients, kahit papaano ho, nakakahinga sila ngayon.
Yes, Pinky. In fact, yung isang COVID ward namin, we had to re-strategize and open it up for non-COVID cases kasi nga sayang yung space, sayang yung beds, and sayang yung resources. So that's a good 60 to 70 beds that we have opened up to non-COVID cases. Kasi ito yung nakikita namin trend sa emergency room and sa outpatient department. Patients now are seeking medical attention going to East Avenue for other medical cases other than COVID.
Opo. Would there be a predominant case or yung merong hubang common na sakit na pinupuntahan ng mga kababayan natin dyan ngayon?
Ang census ng East Avenue Medical Center as far as admissions and consultations are concerned, ang number 1 po sa amin yung mga buntis, yung mga nanganganak. So ito yung number 1 admission namin, number 1 OPD consultation namin. And the rest follows yung mga cancer patients, dialysis patients, and patients requiring operative procedures sa surgery, general surgery, sa ophthalmology also. So we are a general hospital, Pinky, and we cater to almost all cases sa disease process ng mga tao natin.
But how is your ER? Because I spoke to Dr. Jonas a while ago of PGH and sabi nga niya, ang baba din ang kaso sa PGH pero punong-puno daw yung kanilang ER. What's the ER situation at East Avenue?
The situation sa ER ng East Avenue Medical Center, even pre-COVID pa lang kami, puno na kami agad eh. And by default kasi yung mga patients around Quezon City and around Metro Manila, they go to East Avenue Medical Center for their immediate needs and emergency needs. We are also considered a trauma hospital, and that is why yung ibang mga trauma cases, whatever they are, by default dito rin dinadala sa amin around Quezon City and yung surrounding municipalities. And we have actually opened before kasi we have 2 emergency rooms for COVID to cater to COVID cases. But now, yung isang emergency room, we converted this to for non-COVID cases or other cases other than COVID to be addressed.
So puno ho ba ang ER?
Puno. Yung emergency room namin can accommodate around 60 to 70 patients. Pero right now we are doing something like 90 to 100 patients sa emergency room right now.
Oh.
Yung admissions namin, admission rate ng hospital right now is around 93% bed capacity. Pero most of these are non-COVID cases. Like what I've mentioned, we have only 12 confirmed cases of COVID that is now admitted in East Avenue Medical Center.
So talagang tuloy-tuloy pa rin talaga ang trabaho ng ating mga healthcare workers dyan. Kasi even the ER is over capacity.
Yes, Pinky. Even the OPD. Before kasi yung OPD, we had to restrict the consultation days and consultation time. Before, we usually cater to patients from 7 a.m. to 10 p.m., Monday to Friday. But pumasok yung COVID, we had to schedule the consultation from 7 a.m. to around 2 p.m. and Monday to Thursday only. Para yung Friday, ginagawa namin tong disinfection day. But now we have increased the number of days sa OPD consultation from Monday to Friday, and we have prolong the consultation period or the acceptance period of OPD cases from 7 a.m. to around 3 or 4 p.m. in the afternoon. Later on, we will again extend our OPD services until 10 p.m. para yung mga pasyente hindi sila pipila, hindi sila mangangamba kung saan sila pupunta for their medical consultations.
East Avenue Medical Center Chief Dr. Alfonso Nunez. Thank you so much for your time, and I'd like to greet you and all of the healthcare workers there in East Avenue Medical Center a very Merry Christmas.
Merry Christmas to you too, Ma'am Pinky, and to all of the staff of CNN. You're doing a great job. Thank you very much.
Maraming salamat po sa inyo, and I say absolutely more to you guys. Thank you so much for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.